Welcome to today's Explainer. We're about to explore a completely fascinating, bustling micro-ecosystem right inside the human body. We're going to see how modern medicine diagnoses and ultimately treats its most common disruptions. Specifically, we're talking about the female vaginal microbiome. It's a topic that affects literally billions of people, and yet it is still incredibly misunderstood.
So here's our roadmap for today. We've got 1. The vaginal ecosystem. 2. The bacterial takeover. 3. The biofilm fortress. 4. The fungal overgrowth. 5. Real-world health impacts. And 6. Restoring the balance.
Let's jump right into Section 1, the vaginal ecosystem, the healthy habitat.
Okay, to really wrap our heads around this, we kind of need to shift our perspective. You see, the human body isn't just a singular organism. We are what's called a holobiont, and the vagina is a textbook example of this complex, life-sustaining partnership. Think about it. For about 500 million years, humans and microbes have been co-evolving. We provide this warm, nutritious habitat, and in return, the resident microbiota actually produces antimicrobial factors. They act as our very first line of defense against outside pathogens. It really is a beautiful, symbiotic relationship.
And the sheer scale of this environment is just mind-blowing. A healthy vaginal microbiome houses up to 100 billion bacteria. Just to put that into perspective, that is more than the total number of human beings who have ever lived on Earth. Now, the absolute hero of this extremely crowded neighborhood is a genus of bacteria called lactobacillus. You can think of them as the fierce, microscopic guardians of the ecosystem. They absolutely thrive in this anaerobic environment, pumping out lactic acid, which keeps the vaginal pH highly acidic. We're talking lower than 4.5. And that intense acidity, it creates a completely hostile environment for most invading pathogens, which keeps the whole system stable and healthy.
Section 2. The bacterial takeover, when balance is broken.
So, what exactly happens when that acidic shield drops and the ecosystem is compromised? Well, that's when we see bacterial vaginosis, or BV. But here's the crucial point. BV isn't just some simple localized infection. It's a hostile takeover by a syndicate of opportunistic bacteria. Basically, our protective lactobacilli sharply declines, and then anaerobic microbes, most notoriously one called Gardnerella vaginalis, experience a 100 to 1,000-fold increase. It's a massive ecological shift, a state known as dysbiosis, and it is incredibly prevalent, affecting somewhere between 23 and 29% of women worldwide.
If you go to a clinic, doctors actually rely on something called the Amsel criteria to confirm this imbalance. They're looking for at least 3 out of 4 specific signs. First, a homogeneous milk-like fluid. Second, an elevated pH above 4.5, which makes sense, right? Because our protective lactobacillus isn't there to make enough lactic acid anymore. Third, a distinct fishy odor. And fourth, when they look under a microscope, they look for clue cells. These are basically vaginal epithelial cells that are just completely covered in bacteria.
Section 3. The biofilm fortress, the bacterial defense.
Now, treating this takeover isn't as simple as just tossing some random antibiotics at it. To understand why it's so incredibly stubborn, we have to look at how these invaders defend themselves. The main culprit, Gardnerella, acts as a primary colonizer. It doesn't just casually float around. It actually orchestrates the construction of a biofilm. This is a highly structured community of microbes encased in their very own secreted, protective polymeric matrix. It literally acts like an impenetrable fortress, attached right to the vaginal epithelium. This shield protects the bad bacteria from the host's immune system from natural lactic acid and drastically reduces the effectiveness of standard medicines.
Watching the life cycle of this fortress unfold step by step is honestly fascinating. First, the bacteria attach. Then, they secrete their protective matrix. And eventually, they detach to spread even further. Because standard antibiotics often can't penetrate this mature, hardened matrix, the bacteria hiding inside just go dormant. And this perfectly explains why VV has a totally frustrating 50 to 67% recurrence rate within months of standard antibiotic treatment. The medicine wipes out the free-floating bacteria for sure, but the fortress remains totally intact, just waiting to repopulate the area.
Section 4. The fungal overgrowth, the other disruptor.
While bacteria are obviously a massive issue, they certainly aren't the only threat to the ecosystem. Let's talk about vulvovaginal candidiasis, or VVC. You probably know it as a yeast infection, and the prevalence here is just staggering. An estimated 75% of women, 3 out of every 4, will experience at least one episode in their lives, and roughly 40 to 45% will deal with 2 or more. It usually brings along intense itching, soreness, and a thick, curdy discharge. But here's the key difference. While BV is a bacterial dysbiosis, VVC is caused by a fungus, usually Candida albicans.
This side-by-side comparison is absolutely crucial because it clears up so much of the confusion between these two conditions. A lot of people try to self-diagnose and get it wrong. Look right at the middle row, the vaginal pH. BV only happens when the pH elevates and the environment becomes less acidic. But VVC, the yeast infection, that happens even when your protective acidic pH is completely normal. One is a bacteria, the other is a fungus, which means, naturally, they require entirely different treatments.
Section 5. Real-world health impacts. The collateral damage. We really have to elevate the stakes here, because an imbalanced microbiome isn't just some localized inconvenience. The data on this is absolutely staggering. Take tenofovir, for example. It's a vital microbicide gel used to prevent HIV transmission. In a healthy, lactobacillus-dominant microbiome, it works incredibly well, decreasing HIV incidence by 61%. But in a microbiome overrun by BV-associated bacteria, that effectiveness plummets to a mere 18%. Why? Because the hostile bacteria are actually metabolizing and degrading the life-saving medicine. BV is literally acting as a dangerous gateway.
This kind of severe collateral damage is exactly why prioritizing vaginal health matters so deeply. It increases the acquisition of major STIs like HIV, HPV, and herpes. Worse, the bacteria can actually ascend into the upper reproductive tract, causing pelvic inflammatory disease, which can tragically lead to infertility. And during pregnancy, high levels of BV-associated microbes are linked to a 3.3 times higher hazard ratio for preterm birth. We are talking about major, life-altering obstetric and gynecologic impacts.
Section 6. Restoring the balance. Modern medical interventions.
So knowing the immense stakes, how exactly is modern science stepping in to fix this? Well, starting with fungal overgrowth, treatment for yeast infections is highly targeted. We use antifungals called azoles. Uncomplicated cases can usually be cleared up with 1 to 3 day over-the-counter creams. More severe cases might need a longer course or a prescription pill, like oral fluconazole. But a quick note here, special care has to be taken during pregnancy. Epidemiological studies indicate oral fluconazole might be associated with spontaneous abortion, so doctors only recommend topical creams for pregnant women.
Now, treating BV, that is much trickier. Standard antibiotics like metronidazole are the first line of defense. But remember that stubborn biofilm fortress we talked about earlier? Because standard antibiotics often fail to penetrate it, the cutting edge of science is currently exploring biofilm disruptors. These are literally enzymes that melt the protective matrix away so the antibiotics can actually do their job. Even more exciting are microbial-based therapies. Clinical trials are showing that applying a live probiotic like Lactobacillus crispatus right after antibiotics drastically reduces the chance of it coming back. And for the absolute most intractable cases, researchers are even successfully using VMT, vaginal microbiota transplants. They take a healthy ecosystem from a donor and use it to completely reboot the patient's system. It's truly sci-fi level stuff happening today.
I'll leave you with this final thought for today's explainer. For so long, medicine is focused on simply wiping out bacteria, destroying the bad guys. But as we've seen today, our protective lactobacillus guardians are absolutely essential for defending us against profound systemic risks. So how might our approach to everyday health transform if we viewed ourselves not as machines that need to be sterilized, but as caretakers of an entire, delicate microbial rainforest? Thank you so much for joining me to explore this incredible ecosystem.